Welcome back. Testimony in the murder trial involving a mother accused of killing her 3 children is expected to pick back up today. The case, though, is also bringing to light a rare mental health emergency.
Lindsay Clancy is accused of killing her children in January of 2023. However, her attorneys are arguing she's not criminally responsible because of postpartum psychosis. Her ex-husband and the children's father claims that the medication she was taking pushed her into psychosis. But what is postpartum psychosis?
We're going to bring in licensed mental health expert Dr. Cherise Johnson, friend of the show, joining us this morning. Cherise, we want to start here. Obviously, this case is incredibly heartbreaking, no matter which way you spin it. And we're hearing this term postpartum psychosis. Can you tell us the difference between postpartum depression, which is something a lot of women go through, and this psychosis that we're now hearing about?
Yes, because it is very different. So postpartum psychosis is not postpartum stress, and it's not severe postpartum depression. It is a very rare psychiatric disorder where only 1 or 2 out of every 1,000 women who give birth experience. And it comes with things like hallucinations, difficulty with reality, mood disturbances, but it can also shift very quickly, which can make it very difficult to detect.
Well, when we're looking, just at this one particular case, and like you said, it does affect a number of women around the country. What is it about postpartum? I know, Anna, you've even done stories on how the chemical makeup of your brain literally can change in a woman after you've given birth. What is it that changes a person's maybe perception of reality into a dangerous medical emergency, which is what we're talking about here with psychosis?
It's extremely complicated, but essentially, when you as a woman are giving birth, there are a lot of significant changes that are happening at a neurobiological level. So not only has your body been through a lot, but your brain chemistry, your neurotransmitters, your dopamine, which is your ability to receive joy, your pain receptors are all firing off and trying to reconfigure at the same time. And if there's a woman who has experienced any type of anxiety or depression or other mental health challenges prior to pregnancy, she will have a higher likelihood of any type of challenges in postpartum. But it's so unique to each woman, and it can be extremely severe and extremely scary for that mother who is unfamiliar with feeling this way.
Absolutely. And to your point, there's no real screening for postpartum psychosis, right? And sometimes this can be an immediate onset under 15 days, or there's a delayed onset, which is after 15 days. So are there other risk factors for maybe this delayed onset? Is it a lot of lifestyle or socioeconomic factors, or just lifestyle?
It can be a number of different things. We've seen individuals experience postpartum psychosis where they would have what we would consider stable and secure socioeconomic factors. So it really just depends on the tolerance level of the individual. The amount of support that a woman has during the postpartum time is also a big risk factor. And so it's important to make sure that we're not only focused on are they being different, but we want to ask women questions like, are they actually getting enough sleep? Every mom whose baby sleeps is not sleeping themselves. We want to pay attention to, has the nature of their thought patterns changed? And are they truly present, or are they going through the motions and kind of zoning out? But it's also very complicated for the average family member to know what to look for. So asking questions is so important.
Yeah, but as you're asking these questions, Cherise, what kind of answers would trigger a red flag for someone to go, okay, now I'm worried, I'm concerned, I got to make a phone call to a professional. I don't know how to handle this.
Really, if you're in a situation where you're seeing your loved one answer a question, but those answers don't match what you're seeing, that is a huge red flag, because a lot of times we're just naturally as humans trained to go, I'm fine, everything's great. Oh, I'm just a little tired. But we also want to pay attention to behaviors and patterns. So that's a really big call out for us as families, is to not take the word of a mother around everything, because it's also, keep in mind, there's a lot of shame for the mother who's experiencing postpartum. I can only speak to the mothers that I've worked with or in different support areas. A lot of mothers express that they do share how they're feeling, and it is often minimized, and people just kind of say, oh, you're just a new mom, it'll get better. So we want to make sure that we kind of really go overboard in making sure that we're being proactive.
Yeah, Charisse, you bring up a great point about having support, because I think there's a lot of, oh, this is just, especially if you're a first-time mom, I just don't know what I'm doing. This has to be normal. Do you see other barriers, though, in women asking for help, or even being honest when they go to their follow-up appointments where you fill out a survey of how you're doing mentally? Do you see barriers there in honesty and just like not really being sure about what you're feeling?
There's definitely a lot of barriers. Postpartum psychosis is one that can also switch very quickly. So you could literally have a woman who was in distress, and how she would answer those questions if she was in active distress or psychosis could be different 15 minutes later. So one of the challenges and barriers is answering that question, and answering it honestly truly depends on how a woman feels in that moment. And postpartum emotions in general, can change rapidly.
Well, Dr. Charisse Johnson, we thank you for your insight into this. Again, that murder trial hearing is expected to take place again today. And if you or anyone you know, there are plenty of resources where someone can be helped out. 988 is that number you can call for mental health emergencies, and a lot of resources in North and South Carolina. So thanks for your insight into this today. We appreciate it.
Thank you.
Queen City News Plus. Just search Queen City News on your smart TV's app store.